while I was in training, there were no professors who are doing rhinoplasty in my department and throughout other department in my country in ENT. Yeah, I didn't have YouTube at that time. It was 1990 or something, and video was not that much available, and so it was not an easy decision, but I was determined.
Ladies and gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. This month, for the month of February in 2022, the podcasts are brought to us by Medhold Instruments. Medhold make fantastic rhinoplasty instruments. So thanks, shout out to Medhold. And on my guest today on the show is somebody who is so influential in a part of the world that sometimes we're not really aware of, because so much of rhinoplasty seems to be dominated by the European Americans. But it is such an honor for me to have Professor Yong Jang all the way from Seoul, Korea. Yong, thank you so much for your time.
Yeah, thank you for having me in this podcast. It's a great honor for me.
Awesome. Well, I'm really looking forward to hearing all sorts of things. Like the first thing, I get your CV, and I just don't have the time of day to read through so many publications, etc., etc. It's amazing. It's really, I know that you are the forefront of rhinoplasty in Asia. So I want to kick off my first question. Just tell us as the listeners, what was your journey to getting where you're at now?
When I was a resident ENT in Seoul National University Hospital, unfortunately, I had no chance to observe any rhinoplasty, no single rhinoplasty case, because there was zero rhinoplasty in ENT at that time in Korea, and my professors didn't do rhinoplasty. So after finishing my training and military service, I started my teaching career in 1996 at Hanguk University. It was located about 100 kilometers southern part of Seoul, and it is mid-sized private university medical center. And I started my independent practice. There I saw patients, and I started my usual surgeries like septal surgery and sinus surgery and sleep surgery. But I happen to know that there are huge demand on my side, that there are patients coming with deformed nose together with functional issues. So because I was not trained for the rhinoplasty, I was a little bit afraid of approaching them, but I decided that the rhinoplasty should be done by ENT surgeons. So I have huge ambition that, although I didn't have enough teaching, enough training on that, I decided to teach myself.
Wow.
And I started studying through books. At that time, unfortunately, we don't have YouTube. Not that many educational videos. So it was not an easy path, but I collected many books, and I read the video again. And I started my first rhinoplasty case in end of 1996. It was a patient who has cellulose and septal deviation, and from that time on, I did about 10 rhinoplasty cases. So I was kind of an occasional surgeon at that time.
So can I ask you a question? When you were learning, were you already a specialist otolaryngologist or ENT, or was this during your residency time?
I finished my training in ENT residency in Seoul National University Hospital. While I was in training, there were no professors who are doing rhinoplasty in my department and throughout other department in my country.
That was exactly the same with me. I ended up doing 50 cadaver nose dissections. I did 50 rhinoplasties as a resident. I had to teach myself. But we had YouTube. You didn't. You had to get the books.
Yeah, I didn't have YouTube at that time. It was 1990 or something. And video was not that much available, and so it was not an easy decision, but I was determined. I thought that I need to do this because there are patients. So I was quite determined at the time.
So then you started off with that first saddle nose. I mean, from there, it could easily have gone the other direction. I mean, something made you then wanting to really get into it and get to the point where you're actually writing books and running amazing courses, which we want to talk about. But that split could have said, no, I've done one rhinoplasty or few. I don't want to carry on. What made you then want to continue with doing rhinoplasty?
Oh, I see. In my early career, I had some good results and some bad results. And I have one patient quite memorable. At that time, she had a saddle and some deviation. So at that time, I usually ask my chest surgeons harvest the rib cartilage for me. But the problem happened. The chest resident came in the OR and then he made a huge perforation at the pleura. And what he harvested was the combination of rib bone and cartilage. So I couldn't do good work with that mixture of the bone and cartilage. And she suffered a lot due to pneumothorax.
Wow.
And I had a very, very harsh complaint. And it was kind of my defining moment. So
wow.
I couldn't sleep for 2 days. And I thought about it quite a lot. And then should I go on rhinoplasty? Should I quit here? But because of the suffering I had, I decided to go on further. So after that event, I studied more hard, and it was in 2001 in my country, in South Korea. If you are a university faculty, you have a chance to have a sabbatical leave for 1 year. So in 2001, I had a chance to visit any country I want for further study as a university faculty. So first, I emailed to few eminent surgeons in Europe and US, but they didn't reply to me. Because, I don't know why, but so because at that time I was also doing basic research in the nasal physiology. I decided to go to UC Davis, University of California, Davis, at the physiology department to study basic research on the mucosal physiology. But luckily, I have a chance to visit the ENT department there, and I met Dr. Jonathan Sykes, who is quite a famous facial plastic surgeon. We became good friends. So while I was there, most of my time was dedicated to the research, but I visited his operating room twice a week. And it was kind of eye-opening experience for me because actually he didn't send many rhinoplasty, but he does facelift and reconstruction and many other things. The one thing I was quite impressed was that in US, the facial plastic surgery division is quite strong. It's very, very strong subdivision. So at that time in Korea, there's nothing like that. So I have a strong aspiration and longing that this is really a good thing for the whole ENT and for the benefit of the patients. So I was so I returned to Korea in 2002 July. So I stayed in US about 16 months there.
Wow, that's nice.
And when I returned to Dankook University again, right about 2 or 3 months later, I got a job offer from Asan Medical Center, where I'm working now. This is the best and biggest tertiary medical center in my country. It is also ranked as a top by the Newsweek rating in Korea. And so it was kind of huge opportunity for me because it's a big chance for me to promote myself, on the next level. So I accepted the offer. I moved to this Asan Medical Center in 2002 December. It's almost 10 years ago.
Wow. And now how many physicians are there at the center? How many doctors work?
In ENT?
Yes.
Altogether?
Altogether and in ENT?
Yeah. Let me say, the Asan Medical Center has about 2,700 beds.
Wow.
It's tertiary medical center. We have about 500 full-time faculty. Our ENT department has about 17 ENT faculty. So I'm a chairman, professor and chairman there. And when I'm moving to Assam Medical Center, I made my I talked to myself that Yongju, how will you establish your name in ENT society? So my strong desire was I want to make myself as a established rhinoplasty surgeon because this is uncharted territory. I think we need to do this because rhinoplasty is really challenging and every case is different, and it's really challenging and addictive work. So when coming to Assam Medical Center, I decided that I have to build up rhinoplasty practice in Assam Medical Center. And furthermore, one day, if I can, I want to establish a facial plastic surgery society like in US, in Korea. So that was my dream. So although I didn't have that many cases in Dangung University because it was located at southern part of Korea and not that big hospital, right after coming to Assam Medical Center, I have an influx of patients because this is kind of a tertiary medical center. I think that I was not that qualified, but I had to train myself to cope with all the difficult cases. And 2003, right after I moved to Assam Medical Center, it's about 6 months after I moved to that place, I opened my first rhinoplasty symposium there.
No way.
Asan Rhinoplasty Symposium.
And that's like 17 years or something it's been going.
Yeah. In the meantime, I skipped 1 or 2 years, but it's ongoing until 2021. Next year, I will host the 18th event.
Wow. And Yong, this isn't some small little summit. I mean, you've got the big names of rhinoplasty that come out.
Yeah. Actually, when I started for the first time, it was 2003. It was just half-day course, speakers, some domestic speakers, and my mentor, Jonathan Sykes, was a speaker there. So it was half-day course open to just domestic doctors. But from 2005, I opened it to the internationally. So in 2005, our guest speaker was Peter Adamson, and I also decided to do live surgery from 2003 event. I think I was not that much qualified to perform live surgery whole day, but I pushed myself. And after deciding that I will do live surgery.
That's great. So I want to ask you a few things. So tell me.
I trained myself.
So the podcast is going out to more than 70 countries around the world. If people are wanting to be able to access your course, how can they do that? Do they have to be there in person or can they log in remotely? Maybe you want to tell us a little bit more about the course for the listeners.
Yes, actually, until the 16th event, it was offline conference. So you have to register. You have to physically in Seoul, Korea. But in 2020, with the advent of a pandemic, I skipped the 2020 event last year. I opened it as just a Zoom live conference. No registration fee is required. You just register through the website, and then you can enjoy the live coverage of the many good lectures.
And what is that website address?
I will detail later.
Okay.
I think you have very good connection. Later, I will send you the contact information. So in 2012, this year, I will host it on 14th of May.
Brilliant.
Yes.
But they can also follow you on Instagram. You're very active on Instagram if people want to.
Not that active, but I have Instagram account. And so more the information will be uploaded at Instagram and Facebook and LinkedIn. And I have a huge mailing list. So I send them the email for invitation for participating in the symposium. And I also want to get your help. I know that you have a huge, big list of the rhinoplasty surgeons. So So last year we have about 1,300 participants from 70 countries.
Goodness me! There we go, guys. So the doyen of Asian rhinoplasty, I'm speaking to him right now. So make sure you get to this course. So I want to ask you a question about the live surgeries. Because we've run some courses here with live surgeries. And I heard a very interesting comment the other day where a surgeon who would normally take maybe 2 hours to do a rhinoplasty in his own theater where he's comfortable with his team now takes 4 hours when he's doing live surgery. And that messes the whole schedule up and stuff. So an interesting comment was made was to say, perhaps live surgery should almost be pre-recorded in that person's operating theater, and then they can speak the listeners through it. I don't know what you think about that.
Actually, for me, doing live surgery in my center is not that difficult because the surgical setting and the people helping me are really accustomed to that environment. But I had a chance to do live surgery more than 10 countries: Europe, Middle East, Asia, India. I did the live surgery in India more than 6 times.
Wow. Not South Africa yet.
One day, if I can. New instrument. I didn't bring my instrument. I go there alone, but I try to try to keep the time well, and then I think I'm kind of the live surgery expert.
Yes.
Became.
That's awesome. So, Yong, tell me. I want to kind of an encouragement for the guys who are kind of starting their careers. What have been the low points for you in your career? The times we have spoken a little bit about it, but times that you've like doubted and had results that weren't what you were expecting. And how did you get past that to continue being the surgeon that you've become?
Yeah, I think, that's the real challenge if you want to be a competent and serious rhinoplasty surgeon. I think that rhinoplasty demands you quite a big emotional up and down. We have really gratifying result with a very appreciative patient in most cases, but sometimes we have infection, we have cosmetic dissatisfaction. Sometimes we have really, really strange people that we don't know. We cannot fathom the inside of their mind. So I think it's very important to build up your mental fitness and physical fitness. So I spend a lot of time for boosting up, make me more mentally strong, make me more mentally resilient. Because, one day I did 2 surgeries and I came back home and I look back at the operation. Suddenly I have a regret and that I shouldn't do that. In that moment, I become panicked, and
Yes.
I got frustrated and despondent. So, but it's just thought. Thought is just thought. You have to overcome those kind of thought attack by building up your mental fitness. I think there are many ways of strengthening your mental fitness. Physical fitness is also important, but for me, I read many books about just like Stoic philosophy, and
Yes.
as I read something about meditation, and I thought about this life a lot. Yeah. Without that kind of thing, I think I cannot sustain my work.
Yeah.
Because I think I'm quite emotionally vulnerable people. One of
Yeah.
So I know myself very well. So that's why I try my every effort to make me much more resilient and much more stronger.
That's great. So tell me, what are the big things that have changed over the years in your techniques from when you were first starting out until where you are now?
Oh, yeah. I'm not sure whether I think you maybe know, maybe you don't know. In this part of the world, in Korea, in Asian country, the people who are seeking rhinoplasty, they want to have a strong, prominent nasal bridge and nasal tip.
Yes.
The conventional way of doing rhinoplasty, especially in private practice nowadays, nasal dorsum is augmented with silicone, alloplasty implant like silicone. But because I'm working at tertiary medical center, I have influx of many patients who have complications related to the silicone implant.
Exactly.
So I happen to shun myself, keep the distance away from silicone. So I tried many different materials for those augmentation. First, I tried many different things, mostly biological homologous tissue or biological autologous tissue. But nowadays, I ended up with using mostly costal cartilage. About more than 80% of my rhinoplasty cases to build up the nasal dorsum and also to strengthen and augment the nasal tip. So,
and how do you actually augment it? What technique do you use to augment the dorsum?
Yeah, I have many painful experience after I started using costal cartilage. Actually, in 2015, I delivered a Joseph lecture in European Academy. I got a Joseph medal. It was quite a good, great recognition for me. The title of my talk was "The Joys and Sorrows of Costal Cartilage Rhinoplasty."
Yes.
The reason why I chose that title was that we were taught that if we use costal cartilage, you don't need to worry about infection. It's not true. Yeah, we were taught by many surgeons that you have to use autologous tissue all the time. But technically, it's not easy. And also, the problem of the using costal cartilage for the nasal dorsum is you run the risk, very high risk of warping, prominence, irregularity, sometimes infection. So if the patient has very thick skin, I recommend that you can use the block designed cartilage, costal cartilage. But after experiencing so many painful cases of the aesthetic failure, now I ended up with using diced cartilage, glued diced cartilage.
Yes.
Coupled with a little bit of fascia or perichondrium at the outer surface. And I designed a special mold, 3D printed mold. And I call it Jang cartilage mold. And I submitted the paper last year, and it was accepted in PRS, and it will appear this year. And I started using this mold about 3 years ago. 4 years ago. And so far, the result is really gratifying. So I had a very torturous course to find out this material. I used in one day, I used a lot of homologous cartilage, and I found that eventually it disappeared. And I used a lot of fascia. In some cases, the result is good, but in some cases, it causes open the nose like this.
Mm-hmm.
And I found that ear cartilage and subtalar cartilage is not enough in its amount.
Yeah.
And I found that costal cartilage, blocked costal cartilage put on the nasal lotion causes a lot of cosmetic issues. Now, I can tell you that there's no single way which doesn't have any problem. But at least in my hand, so far, this will be my final method, and I think I will be with this the rest of my career.
Oh, it's a dangerous thing to say. You never know what happens. But Yongju, I've seen.
Yeah, that's right. Yeah, you never know what it happened.
Yeah,
but I know there's some problem. There's some resorption. There's a volume loss, but the cosmetic outcome is significantly better than using blocked cartilage. And so it's very important. I think that you pointed out a very important point.
No, listen.
The tricky thing of rhinoplasty is that we never know what will happen 10 years, 10 years later. Yeah, that's the trouble we have.
So I've actually listened to some of your talks and watched some of them on this exact thing. For the listeners, how can they get hold of these molds?
Mold. So the problem is, I asked somebody in our university who working at the design department, and he had a small company, so he's making it. But the problem is, he doesn't have any experience in selling those kind of things. So I got a personal email, so asking how they can get it. So we are improving the system of delivery, and I want to make the people who want to use this one get this more easily. So just wait.
So the listeners out there, I highly recommend it. Instead of taking an insulin syringe or a 2 ml syringe and cutting and putting it, rather get something that's custom made for the nose. So Yongju's got those.
I think it's much more convenient and have some merits.
And you're using Tisseel glue for that?
Yeah, I use fibrin glue.
Yes.
I think it has many different brand name. But any kind of tissue glue would be sufficient.
Yeah, because I'm in South Africa, so there's also a lot of African noses that we want to do exactly the same for, is to build up that flat dorsum. So I've got another topic I want to chat to you about, and this is about the bright or the light and the dark side of rhinoplasty. Tell the listeners a little bit more about that.
The bright side, the most precious bright side for me is that I trained many doctors in Korea and from all over the world. So now many of my my students are practicing in private and university hospital, and they are also teaching rhinoplasty to their students. And so far, I had about 120 international fellows, short-term or long-term, who visited me from more than 20 countries. They are my asset. It gives me a strong sense of fulfillment. That the sense that I contribute a little bit to the rhinoplasty, and that's the most gratifying aspect of the bright side of rhinoplasty. And one other thing is, by indulging myself in rhinoplasty, I got to have many, many good friends like you.
Yeah.
So they're older, big surgeons in Europe and Asia and US. Yeah, we are so close to each other. We became good friends. And also, I could publish many books and could publish many research on rhinoplasty, and those are my rewards. But the dark side is that, as I mentioned before, I'm quite vulnerable emotionally.
Mm-hmm.
So sometimes I have a period of gloomy period because of some series of the bad results and series of problems. And I have a migraine headache. So sometimes, this emotional upset causes my migraine headache, and those are. But I think that's the life. Yes. So this life is consisted of bright side and dark side. So I accept it, and I think I thought that I experienced menopause more than about 27 years. I thought that it's time for me to do rhinoplasty much more faster. But the thing is, my rhinoplasty time is increasing and increasing. So
really?
Because there's something I couldn't see before. Now I can see. So wow. I spend more and more time. So, so I think, as I told you, it's physically and mentally demanding job. That's the. I think rhinoplasty is just like a life. Yeah, it gives me a lot of joy. Sometimes it gives me a lot of sorrow.
Okay, so if you say it's taking you longer to do operations, just as a ballpark figure, more or less, how long would a primary rhinoplasty be taking?
Normally?
Yeah.
When I didn't use costal cartilage, it took about two hours plus. But as I said, nowadays I almost routinely use costal cartilage. It takes about 3 hours to 3.5 hours. But in very complicated revision case, may take 4 hours, but no more than 4 hours.
Wow. Yeah. But that's interesting because you see out on social media guys who are doing 400-500 rhinoplasties in a year. Ooh, I don't know. Hey, that's a lot of rhinoplasties to do in a year, and I don't know what the results will be like if you do 500 rhinoplasties in a year.
But people have a different capacity and capability, and actually, my rhinoplasty case is around 150 to 200 per year, because I am working at the university hospital setting, so I cannot use the operating theater all the time. So I do operate 2 full days and 1 half day.
Wow.
So yes,
oh, that's a lot. And you're teaching, etc. So I've got 2 more questions I want to ask you. The first question is, where do you see the future of rhinoplasty going over the next decade or 2? Perhaps kind of added to that is some of your views on preservation rhinoplasty.
Oh, I see. Future of the rhinoplasty. I think you know that now the deep learning and artificial intelligence and several things having quite big impact in radiology and pathology and internal medicine. But I think the rhinoplasty will remain as quite a human, the area which need real human touch and human hands. So I think in the sense of technological advancement, I don't have any ideas what kind of new technology will bring this rhinoplasty into the next level. I don't have any idea. But I think one thing is that we should be, in our practice, we should be more evidence-based in our practice. Yeah. So,
So
I think that's the right way. That's why I publish many papers. We, in this area, we tend to just follow the big master's opinion.
yes,
Yeah, one master said this is this. Then we just follow with no criticism. But I think it's a kind of a dangerous attitude. So we need to be much more evidence based in sorting out what's the best technique and how we should evaluate the patient and sort of thing. And your second question is about preservation rhinoplasty. I'm really cautious about this because I know what the preservation rhinoplasty is. To be frank with you, personally, on my side, in my area, we have many patients with deviated nose. We have patients with hump nose. So we can adapt that new concept to our patient. But frankly speaking, personally, I don't have any strong urge and need to employ that concept because in my idea, the way I did so far works very good for the patient. And I think here's one thing we have to all consider that in the early 1990s, there was the sleep surgery was quite a fashion in ENT society. So we did many sleep surgery, but many years later, it turned out to be that it's not that effective.
Mm.
But during that many years, many surgeons followed the fashion of the surgery. So I think there must be very good thing in preservation rhinoplasty, but because personally I didn't have that much experience, I'm not in the position to comment on that. But we have to be much more careful, and we have to collect much more evidence to justifying that particular approach. I think the conservatism in preserving the normal anatomy is very, very important aspect we surgeons have to stick. Yeah, no doubt. Yeah, but you have to be very careful and just following the big surgeons' recommendation.
Yeah.
Yeah.
No, you got to be cautious. Okay, so my last question for you, Yongju, is for the listeners out there who are kind of at the start of their careers or they're interested in wanting to become a rhinoplasty specialist. I mean, you've been at this thing for 30 years. What would your advice be to people? How do you think is the best path to go to become really, really top in rhinoplasty?
Yeah, I think rhinoplasty is not an easy operation because there's a real finesse. So just millimeter difference can make huge difference. Just millimeter difference in the nostril level will make the patient very, very unhappy. So if you want to be a serious rhinoplasty surgeon, I think you have to be very, very critical for your result. So I keep all the photographs with me. So I look back with I look back the result with the operation record, what I've done, and I record all the surgeries. I have a very good recording system, so I have huge collection of the surgery record. So sometimes I go back to the video and then so it's very important to train yourself.
Yes.
Train yourself by looking back your cases and update your knowledge with new papers and opinion from other experts. And last but not least, as I said, I want to emphasize that you have to be physically and mentally fit, and you have to be able to become a good doctor who listen very carefully what the patients are saying. That's my. Then I think you can have a lot of fun.
Yes.
It's been many years since I devote myself in rhinoplasty. Still, always a new case thrill me. If I have surgery tomorrow, it will ask me to think about a lot of different things, and it excites me. I think it's kind of I have kind of dopamine surge.
Yes.
Like so that's why I say it's addictive.
That's awesome. So guys, there you've heard it, hey? You got to get physically fit, get off your butt, stop reading your books too much and get fit, get emotionally healthy, listen to your patients, dedicate yourself to rhinoplasty. I mean, what an inspiration this last 40 minutes has been, is to hear your story and to just kind of get a glimpse of what has brought you to where you've done. So on behalf of all the listeners around the world, a huge thank you, Yong, for your time. Medhold, thank you for sponsoring the podcast. And we really wish you all the very best. Guys, if you want to learn how to do Asian rhinoplasty and you want to be inspired, get to Korea, man. Please try and hook up with one of the gentlemen of rhinoplasty around the world.
Thank you.
So thank you.
Yeah, my pleasure. So I respect your tremendous effort bringing all the rhinoplasty surgeons in the world together. So you really quenched the thirst of all the rhinoplasty surgeons in the world for the communication and longing for learning something new. So you're doing a great job.
Awesome.
Congratulations.
Thank you. And we look forward to having you guys again next week on the Rhinoplasty podcast with me, Dr. Cameron McIntosh. Have a great rest of the day.